Good afternoon. We are going to start our third breakout sessions for the day. We're here this afternoon to talk about a city-county community partnership, expanding 911 first response beyond police in Brooklyn Center.
Okay, good afternoon, everyone. Thank you so much for being here at the 3 p.m. session if you're here with us today. I know that the energy may be kind of like waning after a long day of learning and training. And so if you need to move around or move your arms up and down or just kind of be on the side, please feel free to do so. We're really excited to be here today. We are going to be talking about, as Kayla mentioned, a very unique city, county, and community-based dual pilot. If it sounds messy, it kind of is. So we're gonna be kind of like just being as transparent and honest as possible that, we're doing things for the first time like many people. And so we welcome the opportunity to have this open dialogue, talk about what our hopes and dreams may look like, even if it's not fully fleshed out. So this is our agenda. This is how we're gonna be kind of structuring our 60 minutes together. I'll try to keep us on time, but I do just want to highlight that we do really want to invite folks to ask us questions towards the end. So if you have them, please write them down and we'll be sure you get a microphone in front of you. In order to get started, I'm going to invite us to go down the line here in order to introduce everybody who's up here. There are 4 agencies represented which are on the screen, and I'll start here on my left.
Good afternoon, everyone. I'm Gina Obiri. I use she, her pronouns, and I'm with Canopy Roots. And we're a community-based organization who provides unarmed public safety services to local governments. I'm the contract operations manager at Canopy, so I manage our consulting work and contracts. And am I passing it? And I'll pass it to LaToya.
Good afternoon, everyone. LaToya Turk with the City of Brooklyn Center. I'm the director of the Office of Community Prevention, Health, and Safety. My role is to bring a public health approach to public policy in the city. I manage the expanded response teams as well as community engagement. I have a background in public health, primarily focusing on trauma care and public health within community, and also some nonprofit organization.
Okay, good afternoon, everyone. My name is Adesola Oni, and I am an area manager in behavioral health with Hennepin County, and a lot of my work is to help support the folks who are providing care related to our criminal justice behavioral health initiatives, as well as COPE Mental Health Center, and really supporting young people and adults, families, as well as individuals and community. Pass it to Tony.
Thank you. My name is Tony Martin. I'm the Director of 911 Emergency Communications for the Hennepin County Sheriff's Office. We dispatch for 39 of the 45 cities in Hennepin County for police, fire, EMS, and now the alternative response for a few cities that we're going to be talking about here. My background, 25 years in 911, 19 at a local police department here in Hennepin County, and 5 years with the Sheriff's Office.
Good afternoon. Can you hear me? All right. Good afternoon, everybody. My name is Maria Stevenson. I'm the community paramedic supervisor at North Memorial. I supervise the community paramedics on the expanded response team as well as work backup when needed.
Great, and my name is Taylor Crouch-Dodson. I use he, him pronouns, Director of External Affairs at Canopy. I worked with Gina at the City of Minneapolis in some government and policy work. So in order for us to talk about our pilots that are currently and soon to be coming, we first have to look backwards in history to really understand how this work is really rooted in the lived experiences within the city of Brooklyn Center. And unfortunately, within Brooklyn Center, this story does start with tragedy. In August of 2019, Kobe DeMock Heisler, who lived on the autism spectrum, was killed by Brooklyn Center Police Department during a mental health crisis. 20 months later, in April of 2021, Dante Wright was killed by Brooklyn Center Police during a minor traffic stop when an officer mistook a gun for a taser. 1 month later, the city passed a Community Safety and Violence Prevention Act, which was touted by Local Progress as, quote, one of the most transformative public safety plans in the country. This act calls for 911 to send unarmed first response teams to eligible 911 calls and to create a robust accountability system. 5 months later, in October of 2021, Hennepin County presented to the Brooklyn Center City Council about some initial pilot work that they would be doing in neighboring Brooklyn Park. And about a year later, in October of 2022, the city had engaged with some community to really understand what they would like their first responder team to look like, and really to be able to take that engagement to design what would ultimately become a pilot initiative that we're here to talk about. That some funding was approved by the council later in 2022, and 4 months later, in March, Canopy and Hennepin County presented on their experience running unarmed first responder programs in Brooklyn Park and Minneapolis, respectively. And 6 months later, in September of 2024, earlier this year, the City Council approved both contracts with Canopy Roots and Hennepin County, along with partner North Memorial, to operate pilots. I run through that timeline just because none of this work really sits in one particular moment. As you see on that screen, and you may not be able to see it in detail, it goes back multiple years. The work that we've done within Canopy Roots within Minneapolis also goes back multiple years. And when we really kind of see the pilot today and how it's going to grow over the next few years, really kind of ensuring that it's always embedded in that community experience has been something that I think is really important to show as we ground our work together. So that timeline really has also informed what is currently the city's comprehensive approach to community safety, and I'll pass it to Director Turk to share a bit more.
Thanks, Taylor. So if you can take a look at the screen, it'll show our model includes 4 different areas: prevention, intervention, response, and recovery. And within those areas, we focus on 4 different areas. We focus on public safety, health and wellness, economics, and access to life essential resources for all 4 spectrums. Within the prevention model, you'll see where we swim upstream and we try to prevent crimes, we try to prevent mental health crises. We really look at how do we engage community and community partners in swimming upstream to create the ideal opportunities for folks to live a healthy and whole life. Within our intervention model, you will see where we incorporate real-time engagement with our community partners and stakeholders like our schools, the county, where we are actually engaging with young folks or engaging with our stakeholders in our business district to address real-time issues that they're having in their communities. For a response, that's why we're here today to talk about our expanded response model. We'll talk about, in particular, our expanded response model in partnership with the folks that are on the panel with me, but we have multiple partners that are providing a response to our community in Brooklyn Center, and then recovery as well. So after the fact, after an incident has happened, after a crisis, once we hear or we've provided some prevention or intervention, how do we continue to engage with that community or continue to engage on that situation that happened?
Data drives a lot of what we do. You've heard a theme there, I think, from some of the other presentations here, right? Data is very important. This slide, I'm not going to dive too much into it, but really what this shows specifically for Brooklyn Center is where should the alternative response or an expanded response, where should that sit? And ultimately, I think we'd all agree that we need it to be a 24-hour program, not only Brooklyn Center, but everywhere, but that comes down to money. Money drives a lot of this, and I think we're going to talk a little bit about that down the road. But really, I think starting out is, where do you start this? Where do you start a program, and what hours? And so, again, looking at data, and specifically for Brooklyn Center, that's showing 911 call volume and in specific the city limits there. And you're seeing, obviously, the whiter the box is the least amount of calls, and the darker red is where they're getting a larger amount of calls. Now we have, and this one's specific to the mental health and welfare check type calls, where we're not alone. We've looked at national models, and statistically, mental health calls and welfare check calls, about 3 to 5%, really 3 to 6%, can be handled with these alternative response, expanded response, without even looking at the call or those numbers. And so really, and I can already tell you that number is going to keep rising, and so that's why we need to get ahead of this. And so where we're looking and where we're going to be starting the different programs is really during those daytime hours, and then in the early afternoon and then evening hours, not focusing on overnight at the time here. But we've done a lot of this in other elements, but data obviously will drive where we're going to go for the hours.
Collectively, amongst all of our agencies, we've talked about a handful of program-focused metrics as well as community-focused metrics that we want these pilots to ultimately be working towards. I'm not going to run through all of them. You can review these slides later on, but I did want to mention that the data that is collected through 911 is easy to track, and sometimes there's data that is harder to track. And so one of the things that we'll be kind of continuing to focus on is how we might work with community partners to really get to some of those that are on the far right, the ones about how are we reducing overall interactions with police, but then also what is the impact to community, and are we ultimately having a positive resolution of those 911 calls? We can divert those calls to an unarmed first response team, but ultimately, what resources are they being connected to, and other types of services. We do not yet have data on these pieces. This is kind of that preliminary pieces of to say, in the future, over the next few years, we will want to be able to present on those aspects.
One thing I want to touch on here that going back to the timeline, we don't have to go back to the slide, but a lot of it brings up, there's so much work going on years ago. Many different groups, this is specific. Hennepin County created the 911 Mental Health Task Force, which wasn't on that line, but I'll tell you that was kind of the start to Hennepin County kind of driving towards this model and what this looks like. One thing that is very important is that far right of the community-based metrics, and getting community-based organizations to handle some of those calls. And so the importance of decreasing and routing 911 calls appropriately, and really getting and trying to defer that even before it hits 911 in that educational moment.
So a quick comparison of the two pilots that are actually going to be operating. So the first is a combination of Hennepin County and North Memorial. So they're going to be sending one county social worker and one community paramedic. They launched the program actually earlier this year in September. And they are scheduled to run for another year until the end of 2025 is the current contract duration. And they currently work weekday business hours, and this also mirrors another program that they're operating in Brooklyn Park. Canopy Roots, the community-based org that is also kind of a part of this pilot initiative. We're going to be sending out 2 mental health practitioners. We're scheduled to launch in Q1 of 2025 and operate for about a year and a half within our current contract period as a pilot. And we'll be kind of operating over what we're calling like after hours. So that kind of like late evening and weekend shift, that's where we're also seeing high call volume in addition to the traditional business hours. Collectively, both teams will be then covering 7 days a week, about 12 hours a day. And then one thing I'll also note around the funding piece is that it's a distribution between general fund dollars at around 13%, and then grant funds coming from Blue Cross Blue Shield and the POLAD Foundation in order to allow this program to be sustainable for this duration. I'm unable to advance the slide. Unsure. Oh, there we go. Okay, there we go.
Okay, so in terms of what this has looked like for the Hennepin team that started from September up until recently is just some numbers, if it's helpful, is that we've had referrals, about 70 referrals in that period for the alternative response team to respond to. Of those, we have about 50 individuals who are unduplicated, and a lot of the reasons primarily being for mental health and substance use needs, and then that about 44% of the calls were coming from congregate care facilities, which is also a theme that we see across some of the cities that we support. And as we continue to kind of think about what we know and how to better respond, thinking about how we can also provide response and supports earlier to those facilities to minimize and mitigate some of the things that we are seeing. Additionally, what we find that has been kind of primary in the referrals that we're helping people get connected to is a lot of case management resources, a lot of housing resources, and a lot of mental health resources. And beyond the numbers, for me, it's always helpful to kind of hear potentially like a real scenario of what does that look like. So I'm going to try to kind of read through a scenario that one of the teams responded to. So they met with a family, they got a call, met with a family and try to understand what was happening from their perspective. It was reported that the daughter in the family, the teenage daughter, was fighting against some of the responsibilities that she was being asked to participate in. So there was some intrafamilial conflicts happening. And the parents reported needing extra support following a medical event, which impacted one of the parents' physical abilities. In meeting with the daughter separately, our team learned that the young person felt really stressed in having to take on all of those responsibilities that was now being assigned to her, which included some household chores, being able to care for younger siblings, and she wasn't able to do her schoolwork in the way that she wanted to. So both the parents and the daughter reported a lot of frustration. There were some cultural norms and expectations that weren't being, kind of talked about in a way that was helping them resolve what was coming up. And so there was a lot of time spent with the family to understand the concerns, facilitate some conversation, and then come up with a plan that met everyone's needs, and dividing up the chores and making sure that, it felt equitable both to the parent and the young person. So you might see how this is a situation that in that moment felt very much like a crisis for the family that was having that experience, and that law enforcement wouldn't necessarily be the needed response to that call based on what was happening. So this is just maybe an example to help us think through what are the types of situations and who are the appropriate types of individuals and services and frameworks that folks are holding to be able to respond to these calls.
Wonderful. So we are actually going to pivot to kind of more of a now like informal part of our presentation, depending on how much time we have. So I've got a couple questions that I'd love to kind of give to the panel, and then when I've got my timekeeper to cue me in, we can kind of pass the mic around for audience questions. So my first question is for Director Turk from the city. How or why did the city come to decide that they wanted to pursue two different models of unarmed first response within the community?
Okay, Taylor. I'll highlight three areas that were important to us. One was the community request. And so Taylor talked about the timeline that happened in the city. We had two very critical national incidents that happened with our law enforcement, and it galvanized community to come together. There was a community-based commission that was charged, and they made multiple recommendations to City Council, and one was around an expanded response model. And within that recommendation, they did very robust community engagement and engaged multiple stakeholders. And so they were able to make a very solid recommendation to City Council on what their request was from a community perspective. The next thing I would say would be our city's demographics. Brooklyn Center is a small city, but it's sandwiched between two major cities, Minneapolis and Brooklyn Park. And so we are a little city and we get big city problems. We're also seeing a very large increase in our behavioral health, mental health, and substance abuse calls. And our capacity as a city to handle those it wasn't there. We are also one of the most diverse cities in the state, as well as the most economically challenged city in the state. So we needed the support of our additional partners to be able to provide the right response at the right time to our callers. And then the last I would say is the fiscal capacity of the city. We're very fortunate to be able to have partners like Blue Cross Blue Shield, the POLAD Foundation, Hennepin County, and then some public safety aid dollars that allowed us to be able to move forward on the pilot.
I'd just like to add too, I think from the 911 dispatching standpoint, we started this pilot with Brooklyn Park, so we had that going. Minneapolis has had their BCR program going for a while. It's showing success, right? I think there's no question, you're not here to see, is this work or not, right? Jenny mentioned that earlier. It works. It's just a matter of getting that dispatch, getting that team to the right call. For me, and my staff, dispatching for such a large geographic area, and we coordinate with over 25 police departments and 25 fire departments. We can't all get together and get on the same page in the metro here, let alone Hennepin County or even our dispatch area, because of politics and money and just consistency. And so I think that is one thing that one of my goals is I need consistency across my staff. No matter what agency, no matter what city you live in, you're going to get those services, and having that consistent matters. So for me, it goes to that realm, and obviously working with our partners and each of the cities. It's not easy. One thing we're going to get to is some of the challenges. We're up here not again for just the BCR and expanded response piece. It's truly what did we overcome and those challenges. So.
Thank you both so much. So I'm going to pass this next question over to more of our program staff. So and maybe we'll start with Maria and then invite Adesola and Gina to join in to share a little bit about what are some of the lessons you've learned from prior work that you want to apply to this unique three-party partnership.
Yeah, so as community paramedics, we kind of bring a different, unique perspective to the team. As paramedics, a community paramedic is a paramedic with extra training. So we've been on the 911 system, we've done the 911 calls, we know the radio system, the CAD system, how to talk on the radio. That's a big lesson. There's a lot of people that have never done that. We also, in our day-to-day work, help with people with resources as far as like medication administration, organization, resources with finding doctors, getting doctor's appointments made, housing, food, all that stuff. So it's kind of nice that we're able to work with a social worker and help with the resource, the medication aspect of it, because a lot of mental health issues come from or come with medications. Yeah, I think that's it.
Gina?
So I have three things I wanted to talk about, but as Taylor mentioned, that prior to joining Canopy, I worked on the team at the City of Minneapolis that led the work with community and city staff to stand up behavioral crisis response. So I'll be sharing perspective across both of those roles. And the first thing is that dispatch from and close partnership with 911 is essential to our success. 911 is pivotal in making sure that calls are getting to the right responders so that folks can get the support that they need. They're our first responders, right? And that also supports the ease of use for community members. We all know to call 911 in an emergency, so it doesn't require people to learn a new number to know and remember that when they're having a crisis. And it ensures the safety of our responders in case there's a rare instance where they do need some additional backup or support. We know that their location, 911 staff can see their location and they can get that support to them. The second item is that we've learned in our work is to center the experience and the well-being of our responders within the organization. They are all amazingly talented and empathetic and committed people who sign up for this work and they put their heart in it. So if we as a company are prioritizing their heart and making sure that they have the support that they need, then they can continue prioritizing all of us and providing that support when we are having a crisis and we need their help. An example of that is that we have a respite room in our office space for responders to use to regulate themselves and calm their nervous system after they've experienced really difficult or challenging 911 calls. And our program leadership also holds weekly 2-hour meetings called collectives where responders come and they share about those difficult experiences. They debrief those calls, and then the leadership can offer training or other support that may be talked about in those spaces. And then the last thing is that this work cannot happen without community power and pressure. Community support and feedback helps this work happen from the ground up, and it helps to shift the culture of public safety so that wherever you are, whether it's Minneapolis or Brooklyn Center or rural Minnesota, there's an expectation that if you are having a mental health or behavioral health crisis, that you can call 911 and get a behavioral health response. In Minneapolis, thousands of folks responded to the city to share their experiences and ideas in 2020 after George Floyd's murder about mental health and other public safety issues. And this it communicated like an undeniable need for a mental health or behavioral health specific response, first response, so that's connected through our traditional public safety 911 system. And as LaToya had talked about, the Dante and Colby Wright Implementation Committee, they created those recommendations, and then they continued to follow up on those. And sometimes that takes years, and they were able to see changes that directly resulted from their work. So please share your experiences, desires, ideas with your elected officials, with government staff, and other community spaces, because that also helps people who work on the staff side to stand up those programs have kind of the encouragement, but also the evidence, the voices, all of that we need to push that work forward.
For some of the lessons learned, some of the things that came up for me is really starting with the shared vision. So there's a saying, there's nothing new under the sun. Some of this work has already been established in other places outside of Minnesota. So what drove some of the ways in which we implemented our work was the STAR model in Denver, where a number of people went out to see what was happening, what are possibilities. If we're trying to imagine something different, what might that look like? And so coming together, I think it was really important to articulate what is it that we're all trying to accomplish, regardless of what entity, what organization, and at the end of the day, it's really about ensuring that people have the supports that they need at the time that they need it, and most immediately, and in a way that's meaningful for their experience. So having that conversation and making sure we had a sense of a shared vision, I think was really important. And then being able to also look at the templates of what's worked. So we started in Brooklyn Park, the first alternative response team in 2022. And I think somebody had mentioned earlier that there was a lot of conversation about, is this gonna work? Are people gonna buy in? What does that look like? And so even ensuring that law enforcement partners were also on board, and I think at this point, there's a lot of can we get more of that? Because they're seeing the effect and the impact that it's having, so that it's freeing up time for them to be able to respond to other types of calls that they need to be able to respond to. And so using a template to think through, what do we need for contracts? Because all of those details, the devil are in the details, right? What does the contract say? What does liability look like? What do risks look like? What are the data components that we want to measure? What does success mean? How do we know it's working? Perhaps both from the system perspectives, right, and organizational perspectives, but also from those who are served. If somebody's coming to my door, what what is my experience, and then how do I ensure that I can give feedback relative to that experience. So we've had to start to talk through quite a number of those components to ensure that we are on similar pages, and then trying to identify what workarounds, because sometimes there are perhaps needs for workarounds based on what we've created and how we kind of accomplish that. And then staffing also is a thing that we've learned about, because people don't stay in one role forever, right? So what does that look like for coverage? And how do you ensure that, again, you have the right type of training, you have the right type of people who are doing this work, because not everybody's called to do this, to be in this role and to be able to serve in this way. So those are, a few of the things that, I think that we've been able to think through and have some conversations about, come to some decisions around in terms of pulling this together across all the entities.
Gina mentioned all calls start at 911 for the most part, right? I mean, they're going to start elsewhere, but it's when they come into 911, dispatch staff historically has had your three buckets, right? Police, fire, and EMS, and now we're adding that fourth response. And it's important, but dispatchers, in essence, don't care who we're responding or who we're sending, right? We care that we're sending what our system is telling or who should be going based on what we decide. With that being said we need to make sure that it doesn't matter if it's going to be the Hennepin team or Canopy Roots for that expanded piece, or Tony Martin's Incorporated down the road, right? What happens when a city, no offense, but what happens when a city might switch, right? It's potentially another contract, no matter what it is. And so there might be other elements out there that's going to be able to support. I hope it stays, and honestly, I'm a big advocate for one consistent, at least working through stuff. One of the hurdles we've seen is we're creating new lanes, and some of that comes with the liability, contracts. Who here likes contracts and working through that with your attorneys, right? They're there to cover you. They're there to protect you, your entity, your agency, and then to bring in other elements as far as the paramedics or your private ambulance service, right? So that brings another element to that, and then of course trying to negotiate and touch base with all your contracts. That is probably one of the longest processes that we dealt with. And luckily we already had some of that foundation built at the county, working with our 911 embedded social workers. We also have police embedded social workers that I know County Attorney mentioned earlier, that are there. And so we have these contracts that are built. But obviously adding a new element and a new structure takes tweaking and changing that. Well, we also are trying to think strategic, because the last thing we want to do is change any element of that, because what happens? We have to go back and get contract amendments. Not the worst thing to do, but time consuming. And so that's, I would say, the one true thing that I've taken away is let's take the time to do this right. And because I don't want to revert or something happen and then we're without a program or without something, and then we have to go back to the drawing board. And so I think we've had a lot of players at the table, which has helped make this it's succeeded. One more thing on the 911 piece is data. And for us is making sure that no matter who's accessing our data, no matter if you're under a 911 center or a sheriff's office or it's a private entity dispatch center, a lot of the information within the system is criminal justice information. And so we're regulated not only by state statute, but FBI requirements. And we need to make sure that anyone that's able to act, you have to sign your life away when you get hired or in the training piece, and it's every year now. And we need to make sure that everybody that's accessing that is getting that. It's pretty simple, but the logistics and making sure that no matter who's at the end, they're able to do that. And so I think it's just, I could go down the whole checklist. I'm not going to. I can talk a lot. But I think with that, we've learned to create that on our end to help make this process that much smoother.
Say that we did a really amazing job of working together. We took almost a year of having regular meetings together where all of the stakeholders were in the space, and we touched from A to Z, from being very transparent about what each other's contracts look like, what the deliverables were going to be, all the way down to branding. Everyone was engaged in that. There was no siloed ownership. One thing that I would say that I would encourage you to remember when you're rolling out an expanded response team is to keep contact with your stakeholders that are outside of the system. When the recommendations were made, it was almost 2 years before we were able to actually deploy our first team. And so you have, from the outside community, saying you have the money, you know the teams you're going to be using, what's the holdup? And so taking the time to educate them on policy practice and procedures is important. And then during that time, I think we went through 3 police chiefs, 2 council members, and 1 additional national media incident.
You mentioned one thing, though, and I just wanted to point that out, and it's not specific to this, but I obviously, with all this work, is egos aside. Right, I think not all of us up here have different viewpoints, and we all have different agendas, right? Depending on what we're watching our own bobber, but we're listening to make sure what they want, and I think the collaboration, right? Egos were set aside, and it was about the work and what do we need, and moving forward. And so I think that is so important, and so I thank you for mentioning that.
Yeah, and I think that's where it comes back to the shared vision. And even as we continue, I think the piece around being flexible is also important, because the needs that exist today may not necessarily be what exists in the next couple of years. So making sure that we're also reviewing our data, looking at what's coming up, trying to identify trends, and then being proactive to anticipate and to be able to respond and not being reactive, which requires resources which are not always as readily available as we would like them to be. And those are things that I think is important for us to continue to think about, having our radar, because I think we're working with human beings, right? So we have to be flexible to be able to adapt to whatever is also showing up in community.
Thank you for such the intentional conversation, and it looks like I may have time for one more, and then we'll pass it over to the audience. And I'm going to invite probably Gina, LaToya, and Adesola to kind of chime in here. Ultimately, we do all of this work for community, the folks who are going to be receiving these services, but oftentimes, and this is even something Canopy we're even navigating, is oftentimes that communication is one-directional and not two-way, right? And so we're really good at telling people what's happening, what's available to them, what they can do, but often we're not always finding the proper ways to receive feedback from community to inform. So the challenge or question for you all, that I have for you all, is the question is, how do you plan or would like to use community feedback in the design or improvement of these services over the course of this pilot duration? And perhaps we can start here with Gina.
As Tony mentioned, we're talking about challenges, and I think this is kind of an ongoing one for different programs like ours, is how do you collect that feedback kind of as close to the end recipient as possible, and in those crisis situations, that is a difficult thing. So right now, a lot of our community feedback does come from informal ways, like posts on Reddit or Facebook or Nextdoor. And this is cool because it lets us know that folks are talking about the impact of the program in like social circles and social spaces. And it also is a great way for our responders to see their impact in a more kind of human way. And so we're excited to get the results, too, of our MNJRC evaluation that y'all heard a little bit about earlier today. So that'll be a really cool thing to kind of add to that and fill it out. But we've been able to leverage a lot of that feedback to make adjustments to how we work. And as an example of this, for the BCR in Minneapolis, BCR was being blocked from entering some apartment buildings when they were called to respond. Community members heard about this or witnessed it. They contacted council members, which encouraged council to work with others in the city to make shifts that can make sure that BCR can gain access when and where they're needed. And then going forward, we're looking to create more formal ways to receive that community feedback to make those policy or program changes or improvements. And also, as Adesola said, monitoring that data is important to see how things are changing, but also to add kind of a fuller story. We want to be able to get that community feedback to be able to keep a pulse on what community perceives as the evolving needs. And over the last year, we've been standing up a community advisory board, and we're hoping to expand their role in the future to help make this happen.
So we currently have some kind of like feedback QR codes that are being shared after a team responds. And we're not getting a lot of responses, which also makes sense because people are at heightened moments of emotions and experiences at the time that we are kind of meeting up with them. So I think we're having to go back to the drawing board to say, what does that continue to look like? Perhaps it's not in the moment. Do we need to circle back with folks and get any feedback that they might be wanting or willing to share, but at the same time also not overburdening people, I can't speak, relative to trying to collect information. So there's been some work done. I know, Tony, you're going to speak about maybe the HUB partnership, the Hennepin University. I'm going to try to not talk in acronyms. Hennepin University partnerships that we have, and one of the goals of that was really to look at user experience from the 911 lens. And again, we're continuing to just kind of examine what we're currently doing directly with the teams and how we can continue to modify that. We are getting informal feedback from law enforcement partners, from some folks in communities that are being supported, who are sharing back directly, and not as much as perhaps we had anticipated or hoped that we would get. So continue to work through that.
Yeah, the part of the 911 mental health task force that we had, one of the areas we wanted to look at was mental health and 911, and specifically the call. I'm going to fast forward quick. One thing we've already taken away, society of our focus groups and just people that we've talked to in community groups, they lump 911 into the response, or I should say they're lumping the response in with 911. And we knew that, right? Because people call 911 and they just maybe think they're calling a police officer, or they're talking to a firefighter, or they're talking to a paramedic, or now soon to be, hopefully, alternative response, that mindset. But they're actually talking to a 911 operator. And so we really wanted to dive into this. And so Hennepin County has HUP, which is Hennepin University of Minnesota Partnership. It's one of those, you don't know what you don't know. I walked into Hennepin, I had no idea this existed. And so we have that partnership, and part of this is learning, and we used undergraduate student to look at this, because when is the right time to reach out to somebody after a 911 call to check to see how everything went? That day, a week later, a month, they could be going through the mental health crisis that entire time. And so a standard, survey call is not going to work out for that person, right? Or an email survey, and because we only have that number. But also looking at, because when you call 911 in the state of Minnesota, your identity is protected. So we also can't just give that information to a third party to go do a survey to check to see how your response was. So this group, the undergraduate student, they created a report, and we really went to 3 phases. And the first is focusing on getting into the city surveys. And so for this pilot, we got into Brooklyn Park survey, the city survey that they do, for all their city services, but they added some 911 specific questions. And then we were able to get into Minnetonka, their survey. And so that's going to be the quantitative data. That's numbers, right? Hey, how was your experience? Phase 2, we just started, and we're actually in the middle of this. It's the quantitative data and hearing from people and focus groups. And so we've met with the Oromo community, and we've met with some Latino groups. We actually have our youth group tomorrow. We're meeting with youths. And so we have some others that we're working with Hennepin County's Trusted Messenger program to get the community feedback. And like I said, some of that data has already been that, it's about the response, or not getting a police officer, or the delay in the response. And so that helps us, because part of that, right? we're doing something right. Now, there's always ways to improve. We need to evolve. I've been doing this 25 years, and I could say, well, the way we did it 25 years ago, it worked. Why are we changing? No, we need to evolve. We need to move forward with stuff. And I think that the feedback aspect to that, specifically about 911 and how the mental health aspect, and so really diving into different platforms of that. And then the quality assurance, just the analyzation of our own internal stuff. What is our protocol? What is our process? And how did employee A, B, or C do to that? So those are a few things for us.
And from a city perspective, we are looking at a dashboard to be able to have public-facing information that we can present out to community. But we also heavily rely on our trusted community messengers and partners. And so we actually go into community spaces that are culturally specific for that community and utilize those trusted messengers to deliver the message. And so I'll have quarterly meetings with those messengers so that we can get shared language. And then as city officials, we'll go into those spaces to stand to answer any questions that they may have about public safety initiatives that we are deploying. Also, our schools. In our comprehensive model, you'll see intervention and recovery. We have community partners that partner with our schools, and they're in our schools. And when you are actually in the space where someone is comfortable at, they will share that information. And we do have a lot of data privacy restrictions in sharing information across line, but community, they don't have those same restrictions. And so when you're in the space and you have a trusted messenger and you're consistently showing up in that space, folks will share the information that you need to capture.
Thank you all so much. I feel like I'm interrupting a conversation, but I do want to turn the attention over to see if we have any audience questions. It looks like we probably have time for like 2 or 3 total, so maybe we'll start here, and I'll look out for other hands.
Hi, my name is Elena. I'm with Foster Advocates. We do advocacy organizing and systems change with those who've been in the out-of-home care system across Minnesota. And I'm just curious, I saw the data point that said a lot of the calls are coming from congregate care centers, and wondering what overlap you have with folks who are in the foster care system, if there's partnership with Hennepin County Child Welfare as part of this, how behavioral crisis response is being considered as part of either family prevention support and/or supporting fosters who are having behavioral crisis while they're in the foster care system.
So monthly, we host a community call called Community Crisis Response Team, and we have various stakeholders, some from the county that are there, and we do real-time problem solving. And so the county will say, these are some concerns we're having, these are some access points that we are not able to meet, and so how can your community partners support us in this area? And we are able to deploy a plan in real time. So that's one of the strategies that we use in the city.
We also have a number of partnerships, of course, within Hennepin that we work across different areas and programs. So really specifically related to youth, we have family response and stabilization services that operates 24/7 and really hones in on the needs of young people in any community. So that service, that support is available to anyone. And I know that, the county attorney's office also mentioned that earlier. To anyone in Hennepin, they will show up within an hour, 24/7, to kind of support anyone in any kind of setting. And the individual and the family gets to define the crisis. So we're working with folks in that setting for young people related to foster care, and also with congregate care. It's really also about establishing relationships with a number of the providers and helping inform and provide kind of supports around issues that they might be seeing and resources for them, so that they're also connecting the individuals that they're supporting in their organizations to the care that they need most immediately, thereby preventing calls to 911.
That you'll see congregate care for the City of Brooklyn Center We are saturated. We have the most congregate care living facilities per square mile in the state of Minnesota. We also have a paid on-call fire department. And as we know, nationally, police numbers are down. And so the calls for congregate care, basic services like lift assist, were really exhausting our responders. And so we're very fortunate to have our expanded response teams be able to divert some of those calls too.
Thank you, Jermaine, for hustling over there.
Hello, all. Thanks so much for your work. I have kind of an in-the-weeds question that's maybe for those of you in government and governance. Obviously, contracts conversations, and you spoke a little bit about the time that it can take to go through contract negotiations and all the compliance things you have to go through. If there's only certain leaders involved in contracts conversations and ultimately a decision to move forward with a pilot like this, how does the communication then go out to dispatch, respond, like others in the infrastructure, and what's the response like? I mean, is it just like, we're trying something new, here's what it is? Has there been pushback? I'm just, when we think about innovations like this and how we scale them, even if we can plan for it to take a long time, I'm just curious what the response has been and maybe how that was communicated, if you're able, to the extent you're able to speak publicly about that.
Yeah, I'll start a little bit about that. And I think no matter who speaks up here, change is going to be difficult in any governmental agency, right? Because you have processes, you have your procedures, and you have people that have been there for many years. You have some new people. I'm going to backtrack some of the studies we did, and we looked at Eugene, Oregon for the was it Cahoots? Yeah. And we tried to talk to the dispatch staff to say, hey, what's it like? They don't know anything different. They said, this is everybody that's worked there. That's all they knew, right? And so then I'm going to fast forward to Denver Star going out there. Sorry, I almost hit you in the face. Denver Star, and they, that's still new, and so it's just them kind of learning and so that's changed. For our staff, very similar is they just want a direction to go, but they also need some of the difficulties are because we are going into unterritorialized area, because we can't just cookie cutter, take Cahoots, take Star, take Albuquerque, you name it. You can't just take that because we have our own thing here. So part of being a pilot is there's going to be some uncomfortable times for this learning, and a lot of our staff, especially I'm going to speak on the dispatch side, we're very, very, I don't want to say we're overworked with less staff. It is a very difficult job altogether in general, and I'm not up here to speak on that, but we could talk afterwards, is the challenges there. And our callers don't call to tell us exactly what's happening. A lot of times they just give us some basic information, and then our dispatch staff has to make some of those choices. And what do you make? So, and it goes back to experience that they haven't dove into that, so they go to what their comfort level is. But also there's a lot of liability in 911 about, and we've talked about that, but there's also liability about not sending a expanded response or someone different. And so it's going to take time in that, but it's also working on creating good and clear processes and procedures for our staff to follow. And honestly, and the support. My staff, they have my support and some of that gray area, and we also encourage their feedback to come back to that, because it's important that we're learning and we're making sure that we're getting this right. And so I think with that, it's and timing, it is deflating because, it's like we want to move, we want to do this quick. I'll tell you, we did our presentation to our dispatch staff 7 months before we started because we thought we were moving forward and quick. And here we are 7 months later, and now, they forgot yesterday, let alone 7 months ago. And so it's that refresher and keeping it live is important. And I'm gonna speak on behalf of.
Actually, I'm seeing the time. I do so appreciate that, and I do know LaToya wants to say something, and then I think we'll we'll probably have to conclude, so go right ahead.
Thank you. So from a city standpoint, one thing that we utilized our internal communication process. There's 7 other directors across the organization. We have weekly check-ins, and I would give them information on where we were, and then allow them in their own way to be able to distribute that information to their staff. Also, regular community check-ins, and then here for us having shared language. My staff, they have access to me, but my law enforcement, they also have access to 911 dispatch. And so if I give them a message and they get off the phone with me and they call Tony, he's giving them the same message. So then we have a shared message and we don't have confusion. Consistent updates with timelines. So yeah, that's what we did. We just over communicated.
And just to kind of conclude this section, I do want to just celebrate LaToya for just a second, because we've been a part of a couple different contract negotiations over the last few years. And even before any ink was dry, even before contracts were finalized in draft form, things were being shared so early and so often, and actually bringing this whole group together way before anything was like formal. So even in those like informal stages of, well, we're kind of thinking about partnering with you. Like, we've got the money, we want to make this happen, but we're still waiting on legal, or we still need to wait for this other thing. That doesn't mean that we can't start the work knowing that this is going to move forward. She created a sense of confidence and security, but also really created a sense of transparency that, from my perspective, seemed really rare in government work. So I guess the challenge almost then to other jurisdictions would be, can you follow that same level of transparency and really bring these partners together in this way? Because I think that's really, it's what's setting this up for hopefully to be super successful. And I recognize that we're probably at the very end of our time, so what I'm going to ask is for a rapid response to our conclusionary question, which is, what are you most excited about for this partnership? To kind of take inspiration for Dr. Jinwright, what are you dreaming about? What are you most excited about? And we'll just kind of go in order here to the end.
I don't do well with think on the spot rapid response questions, but I probably would say that I'm excited for our organization to expand into a smaller city. Minneapolis is one thing, and Minneapolis has its own dispatch center, and so expanding into Brooklyn Center gives us an opportunity to learn about the Hennepin County Dispatch Center and what it takes to, what all goes into that when you're managing for many different jurisdictions, and to learn the uniqueness that exists within Brooklyn Center.
I think one of the things that I'm most excited about is the impact that this will have on the city of Brooklyn Center. So to be able to have a diverse group of folks responding to behavioral health calls, also the resources, having access to resources. We heard some moderators earlier say that there are the resources, but there's not access pathways to it. So being able to create those pathways for folks to get the services and support they need.
I think I'm excited for folks to get the supports that they need, and I'm excited for the possibilities that this brings with it, so that we can have embedded or woven into the fabrics of, you know, what resources are available. This is an option for community. So, yeah.
For us, we already have something with Brooklyn Park. We already learned from Minneapolis. We are diving into having that county private company partnership, and I think I'm also excited to move from a pilot phase into actually implementing protocols. There's a lot of work that goes on behind creating our response plans for cities, and we haven't made those official changes yet because we wanted to learn, and obviously we are moving towards that. And I think just we're here. I think where we are today, that's what I'm most excited about, and where we're going to be tomorrow.
I would have to say, I personally think that this is the way that the 911 system is heading, is getting people the help that they need when they need it. And I am super excited to be on the forefront of that and be able to get the ambulance service just feet in the door and working towards that.
Well, thank you all so much. Please join me in a round of applause for our panelists. Thank you all for sitting here, and thank you for your audience today.